Today in this session, we'll be talking about a very different topic, but I'm sure this will be very helpful for you in your PG training and also in life. Uh, Today, we're talking about how to improve our efficiency in life, and we call it improving personal effectiveness. And in personal effectiveness, there are a lot of tools. And today we'll be focusing on one of the tools, which is time management. So I'm sure you all would be suffering that if we would have more time, we would have done many more things, many more accolades would have been won. I would have done my work in a much better way. So time management is I think something which is essential for any successful person in whatever sphere of life. If you read about any great personality, successful businessman, sports person, surgeon, anybody, everybody, one thing will be common between all is that they manage their time very well. So we all have this constant complaint that we don't have time. But if in this world, is there anything which is equal to all, irrespective of their gender, irrespective of their what state they come from, what country they come from, what gender they are, what age they are. There's one thing which is common and equal to all is time. So I don't think anybody can say that we don't have time and that person, the other person have time. Everybody has the equal amount of time. What actually we need to learn is to manage this available time into things which are good for us, into things which are important to us, and then I'm sure we'll not be putting this complaint. So that we'll try to learn in this session. So let's watch this video and let's see what it says to us. This is about Formula One. I'm sure you know and you enjoy Formula One races.
But Holland comes in for a pit stop. Time to refuel and change tires. Lou Moore himself changes the tires. Only 4 crew members, including the driver, are allowed to work on the car. It's a tense time. Holland stays in his seat, anxious to get away. Let's watch.
Can define whether you will win or whether you will lose. Tires are being
The tires are changed at last. A crewman polishes the windshield as Holland moves away just 67 seconds after he stopped.
So they took 67 seconds. And at that point in 1960s, it was a world record. The whole world was raving about it, that how can they do it so fast? And this is what the time they took. And so very easily what we come to these points when we have, okay, we are successful, we are very good, we have got good rank, we have got good seat in a PG course, and then somehow we relax. So because we think that we cannot get better than this. Now let's see the second part of this video. Now this is 2013 now, around 50 years later. Amazing, isn't it? So it took 1 point some seconds, and this is the norm now. From 69 seconds celebrating it to we have come down to 1 second or even less than 1 second rule for pit stop. And this is possible only because we at no time started accepting that whatever we do is the best. We always have to feel that how things can get even better from here on. And that is what personal effectiveness is. Constantly, we should keep looking at things uh, which can be improved in ourselves, and then keep moving. So 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 we'll talk about time management today. And I was saying that we should manage time. But again, one of my guru or mentors says that, we can never manage time because time is outside our control. What we need to do is to manage ourselves against time. You cannot manage time. Like, whatever you do, you cannot increase the number of minutes, or you can stop the time at some point. What we need to do is to prioritize our activities, our actions according to time. So it's called self management against time rather than saying time management. Okay. So we by time management, we cannot uh, increase, slow down, or fasten the time. We have to, whatever the management will talk about is our management against it. So again, this question, if I ask you, do you have time? And most of the people, especially in your PG ship, will say, no, no, we don't have time. We don't have time for anything. Your family members might be calling you that, okay, there's a special, this very special function. There's some birthday party. There's some marriage in family. You'll say, no, 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 I don't have time these 3 years because there's so much to do. But remember, we spend a lot of time in doing things which are not important to us, and that's what we need to manage. If we start cutting out time from there, I'm sure we'll have time for other important things like family, like hobbies, like personal health, mental health, friends, vacations, recreation, a lot of things. But the only thing is we somehow do not take those steps which will be useful to us. So uh, when we talk about time management, planning is the thing. We should plan whatever we want to do and everything we want to do. And the first step towards time management is somebody who is a beginner, and the bare minimum thing which we need to do, which everybody should do, is to keep a notes or checklist or a to-do list that I want to do these things. Maybe today, maybe in this month, maybe in this week, maybe in this year, maybe in my lifetime. There can be different checklists, but they should have a list of to do things. That today I have to do dressings, today I have to read about this topic, and today I have to write a review of literature for my thesis. And and whatever keeps happening, you just keep ticking it. This is a bare minimum, I think, which everybody should do, irrespective of your age, irrespective uh, of where you are and what role you play. So this is the bare minimum. Start with that. At least start creating list. Once you get comfortable with the list, or you already are doing those checklists, I'm sure you all are doing. You cannot do word work without maintaining a list of work. The kind of round book with residents will carry, where they will write the daily instructions and they will complete it. It's all lists. When we send a list of investigations to the patient, and then we keep ticking it, there's again a list. So these are all around us. So for all our activities, even our personal activities, I think we need to maintain this checklist or a to-do list. Once a to-do list is there, try to start putting these lists into our calendars. So I have, let's say, 10 things which I need to do in this month. I will start putting the list into, okay, this I'll do on 12th, this I will do on 14th, this I'll do on this. And you know which days are free, which days are not free, and things like that. And accordingly, I'll be able to schedule these to-do lists or activity items. Uh, if it's in the day, then you start putting it according to hours or minutes or half hours. That, okay, at this time I will do dressings, at this time I will read, at this time I will go to OT and assistant surgery or the perform surgery. This time I will teach undergraduate students, whatever it is. So start planning and start putting it in calendars. Then you will see that a lot of things are clashing. For example, you have scheduled something to study, and then some friends come to you and say, okay, can we go out today? I'm feeling little sad and low. Can you go with me? and you say, oh my God, now what to do?